we can actually use technology in a systematic way to change the way, transform the way that we deliver services. It's fundamental for us to get our data quality right. Having the NHS app as a trusted source of information around your health is going to become increasingly important. The technology enables that. It enables a very personalised experience. The aim of the single patient record is to bring it all together. I think data is the heartblood of everything, not just in health, but in other aspects of life too. In a 10-year plan, you have to be visionary.
Yeah.
You're not going to talk about the nuts and bolts. What we're really creating is a platform to support multidisciplinary working.
Yeah.
This is only going to survive if it's an augmentation of the human. Right? We have to change the way the NHS is operating with industry. I think inclusion is actually quite hard at a national level. With the neighbourhood teams, there's a real opportunity.
Ming, welcome to Voices of Care. Thank you for taking time in a very busy schedule given the publication of the 10-year plan. It's great to have you here.
Thanks, Suhail. Absolute pleasure to be here.
And I'm just going to step back a bit because I think your background in pharmacy, consulting, I think you joined the NHS, I don't hate to remind you, it's about 15 years ago, and I think you're intending to stick around for 2 years, but you're right in the middle of a technological revolution where the analog to digital change is promising the most digitally enabled system in the world.
Yeah, I mean, I've never really managed my career in a kind of systematic way. So I go where the opportunities are. And this was, working in the NHS gave me such a lot of ability to direct and create some value. So I stuck around while I can still add value.
Absolutely. And obviously the 10-year plan, we've had the 3 shifts which have been around in conversation and policy for a long time. But I think the King's Fund reporting on it talked about the digital transformation being perhaps the golden thread that walks all the way through. And I think you've been on record as saying it's really part of the fight back against disease and the promise of genomics and technology. There's a chance here to really make a big difference in people's lives.
Yeah, very much so. I don't think we can do prevention unless we tackle those 2 things, right? Because so much of it is behavioural, as well as your genomes and your genetic sequences provides certain markers that give you different risk profiles. So I think that's really important. It's really important to understand that and to help people understand that. So we're using technology to really assist patients to better understand that. We'll have to do lots more counselling as the profiles come out. But what's really appealing to me at the moment is that we can actually use technology in a systematic way to change the way, transform the way that we deliver services, but also transform the relationship between the public and the NHS, which is a really difficult thing to do in normal days.
And actually required, given the fact that obviously over the last decade or so, the approval ratings of the NHS have fallen significantly. So this is a watershed moment. I know we're going to really focus on this in this discussion around patients, the people within the NHS, and really the promise in the future. So I'd like to start with perhaps the fulcrum of all of this, which is the patients. And the 10-year report plan, makes it very clear that whatever the 3 shifts are, the core purpose is to empower patients, and it's redistribute power, build a relationship. And there's a number of things that do that. I'd like to start perhaps with what's going to be the front door with the NHS app. I know you've worked on that. That's, I think, translates data into action.
Yeah, very much so. So in a way, let's step a little bit back and say, actually, the NHS is becoming 40% of our actual money,
Yes.
the GDP. That's a lot, right? And isn't it fantastic to live in a country where care is free to all and point of need? So to do that, we need a public contract change because we've kind of drifted into whatever you can't solve, the NHS will solve, and we can't solve all the problems. I think using technology in the NHS app as a method of really engaging with patients is really important. So when we say the digital front door, it's really to make it more convenient, bring the NHS up to speed with other things that you do with retailers, Amazon, your banking, everything is you'll have an app for. So why wouldn't we have an app for the NHS? At the moment, the app doesn't allow you to do all the things you would like to create access better. So really engaging the interface for the app for our other core services, making appointments available, making it clear that you can get your tests, allowing you to see your patient data, allowing you to really juggle things in a more 24/7 way rather than when we're open is really important. But also, with all the disinformation out there, having the NHS app as a trusted source of information around your health is going to become increasingly important.
And also, it's also a platform, potentially, the 10-year plan is painting a picture of patient power. The feedback from patients could inform decision and where resources flow.
Yeah, no, absolutely. So these are kind of policy tests that we'll need to test over time. But the technology enables that. It enables a very personalised experience. Whereas, when we normally do public engagement, it's all through emails or text, or it's quite a blanket. Whereas with the app, you can have a very personal, you can almost target for this particular condition. You are one of those people with a long-term condition. How was your service? How would you like to be treated? What additional information do you need to help you look after yourself? Can we connect you with other services? This is where we're bringing kind of the voluntary sector. So for those that are more disadvantaged and don't always have access to family, that's really important, bringing in those other services so that, then your neighbourhood, the health is such a part of your neighbourhood.
And I think that's really fascinating, that the personalized nature of it. But from a productivity point, going back to your bigger picture around GDP, and I think the Health Foundation projections to 2040 say 1 in 6 people have got major conditions now. That's going to become 1 in 5. And talking about productivity, I think the numbers are the NHS spend approximately £200 million sending texts and letters. So just an example of how the NHS actually can be preventative, personalised, but also productive.
Yeah, very much so. So what a lot of people, you'll notice yourself as a patient, there are disconnections in the NHS where lots of chasing around, waiting for emails, waiting for letters, worse than texts and emails, which don't, you quite often get an appointment when you've just had one, or, all those things happen. So the logistics of all of that, because they're not synchronized and not done to follow the person, it follows the service, means that we waste a lot of money. I think by getting behind a more patient-centric lens will help us get rid of some of those misconnections and make care safer, make it a smoother journey, and waste less time for the staff and for individuals.
And talking about time and disconnect, and I'm someone who's looked after my mum and other relatives, and I'd like to think I know the system, but my goodness, it can be challenging. Just briefly on the last point on the patient journey, although that patient is central to everything, is talk to us a little bit about how important data and access will be for the single patient record, because that promises quite a fundamental change.
Yeah, so the single patient record is born of, if we really want to make the NHS person-centric, patient-centric, we have to gather all the information, all the events, all the interventions, all the touch points you have with the NHS. It's going to be necessary to have a thread of that, maybe not to the nth degree of detail, but actually, and we're working through the technology, how we do this, but the way I see it is a series of events that need to be coordinated. You need to have information so that you know which part of the pathway you are. The clinicians need to know that the tests they asked for or someone else asked for, they can reuse. They don't have to redo tests. So all of that is really important. That means it's fundamental for us to get our data quality right, getting the data, the source systems where it's actually your consultation with your clinician and he writes it into your medical notes. That still becomes the source data. We're not changing that. This is about orchestration of that data, to free that data up so it can be used to help the activities and the orchestration of the patient journey, and make sure that the right information is presented to the clinician. This is a productivity piece, because a clinician can't be expected in a 15-minute consultation to read your whole history.
No.
So that's why they often re-ask, because they want to double check, right? Maybe they've already skim read it, but they want to double check. And that's frustrating for patients, particularly if you've got complex conditions and you're going to see many professions. So that's the aim of this single patient record, is to bring it all together. The nice thing is, once you've done that, you can then do different things with that information. You can then start forecasting the usage. You can then actually help anticipate the next steps in the pathway for a patient, help give them more choices. You can actually provide more information at the right place. And actually, there will be some patients that you say, actually, you don't need to see a person anymore. You would be better doing a CBD for mental health or whatever. Or actually, you're well enough to look after yourself. Here's some monitoring equipment that you can actually look after yourself. We'll always be there in the background for you. But it just means you don't have to have the checkups until something goes wrong. Having all that information is really important for those newer ways of working.
And brings to alive the potential for the virtual wards, remote monitoring. And I guess for someone who's not a data expert, it brings to the fact that what kind of seemed like a dry subject, data, actually the analysis of it makes huge, data saves lives.
Yes, very much so. So if you think about how data is used for research, for finding new conditions, in surgery, how we can actually get better through feedback on what procedures actually work. In medicines, actually making sure that we're identifying those medicines where there are side effects, where they antagonize each other, and in future your genomic profile would determine what drugs will be more suitable for you. All of that is dependent on data. So I think data is the heartblood of everything, not just in health, but in other aspects of life too.
No, absolutely. Let's move on to the people of the NHS. Obviously, again, we have a productivity imperative. The workforce is going to look very different in 2035, probably less people doing different things, the plan says. Talking about the digital transformation and what you and your team are doing, I wanted to focus on the promise of the ambient voice technology, because the small iterations can have a big difference. I think the stats are showing something like 14% of clinician time is taking data entry. So talk a little about that technology, because it is around already and it shows tremendous promise, I think.
I think ambient voice, it shows tremendous benefits. We have to make sure we're setting it up to succeed.
Yep.
And we don't waste that opportunity, right? So in a way, when we've created electronic patient records, we've made a cadre of very good clinicians into administrative people in entering their data. So the technology is now caught up that, the benefits are you can spend more time with your patients. It automatically tracks that. A data benefit is you can then decide how to codify based on, once it's digitized, you can codify it easier using AI. So that will improve data quality and completeness and all those things. So it's all benefits. But we need to understand how to roll it out, where it's used, make sure that it's part of, it's checked in terms of it will be a clinical device, so a medical device, so it will have regulations around it. But also making sure that the way that the data is captured is suitable and ethical, and actually the endpoints are actually safe and secure, because what we don't want is that information from a very personal consultation going into the wide web because we've not secured the endpoints. So all of those have some kind of administrative, technical, governance kind of ideals. Had a really exciting conversation about it with the Royal College of Physicians this week, actually, earlier on this week. We want to embrace it, but we want to do it in a way that actually enables everybody.
And also protects, of course, the patient data, because I think the plan makes it the access to this secure, transparent data is a right rather than a privilege. One quick other part, which I know you've led this now, the Federated Data Platform, again, an ability for interoperability, for different systems to speak to each other. Tell us how important that's going to be in this architecture as we add additional functionality for clinicians to be at the top of their license.
So the really lovely thing about FDP that people don't often realize is it is a data platform, so it helps you connect all the data points.
Yes, it may not be pretty, I think you said once.
Yeah, it connects all the data points, brings all that disparate data together. The NHS owns a data model that it's conforming to, which is brilliant because we can lift it and use it elsewhere. The second bit about it is that it's quite an unusual product in that it has workflow integrated with it.
Right.
So the whole point of bringing data together at a decision point is because you want to take action.
Yep.
What FTP allows you to do is create products that allow you to take that action, to do that coordination, to do that follow-up, to show you what other information around that patient is available, to do planning or research or whatever it is that you, not research, but if you want to change the way that you want to process those flows,
Yes.
you can do that quite easily. You can test in it. The other thing is, because of that, you're automatically creating metrics that can then give you a very good view of productivity and actually performance. So all of those things are fairly automated, which means you don't have to have lots of teams doing separate reporting and gathering of that data. So that's the benefit of it. The biggest benefit, when we use it properly, is that you do certain things once, and it allows the NHS to learn from others, build on that, and augment, right? So the solution exchange at the back of FTP allows other people to build on the infrastructure using a consistent data model, using the workflows, so that you can test it in a number of sites, and if it's suitable,
roll it out.
That's the benefit.
So the variation of performance, you're actually going to...
Very much so. And it's not all going to be centralised and it's a centre team doing it. Local instances will allow local licenses at local trusts and ICBs, means that they can do the things that are important for their population.
Absolutely. Now, this is a brilliant vista that we're painting in terms of the patient empowerment and, of course, the workforce on a couple of the items we talked about. Lord Darcy's report from a year or so ago was very open, saying the NHS sometimes is not. He was drawing on a National Audit Office report saying that digital transformation in the NHS sometimes doesn't go according to plan. Just want to highlight some of the pitfalls. What are the things that we need to make sure that we have to get right for this vision? I'm thinking of the basic foundations. I think it was the BMA saying something like 13.5 million hours of clinician time was diverted because of malfunctioning IT. So just the basics, I guess. We start there, don't we?
Yeah, so I think in the 10-year plan, you have to be visionary.
Yep.
You're not going to talk about the nuts and bolts, right? So a lot of people say, oh, you didn't talk about digital foundations. It was in the working group.
Which you led.
Which I led.
Yeah.
So, and it is in the SR bid. So we need to continue to invest in normal devices and all of those things. We're not walking away from that. I think there is a bit of making sure that people are ready.
Yes.
So change doesn't happen. Technology will not create change. What we need to do is really combine process change, people's acceptance, and we train and we work with people. So
upskilling digital skills are going to be vital, aren't they?
Yeah, it's whether it's digital skills. I mean, you don't really see many people trained to use an Apple phone, right? Because it's quite intuitive.
Yep.
So that's the target we need to get to, so it's intuitive. But we will need to change some of the processes, because what we're really creating is a platform to support multidisciplinary working, more collaborative working, which has always been difficult and managed by spreadsheets and phone calls and all of that. So that's what we're taking away, some of that with the FTP. The other bits of digital is just having that digital assistant will help people do their jobs more effectively. I really value the technology, but this is only going to survive if it's an augmentation of the human, right?
Yep.
So we need clinicians focused on the clinical activities. We need porters to be able to know where to go next with the beds, etc. That is technology, but it's also helping them do their job. So I'm really passionate that as the technology advances, we're actually making people's lives easier.
Yep.
And that is both our staff and for patients.
Absolutely. And staying on that point of making sure everybody comes on the journey, digital inclusion, of course, is really, really important, from the fundamentals of people from particular backgrounds not having access to the latest devices and people not being able to get access to training, etc. Talk to us a little bit, because I know that you're personally extremely passionate about making sure, and the plan makes it very clear, that inclusion must be by default, it's going to be included.
Yeah. So I think inclusion is actually quite hard at a national level, because the diversity is everywhere and you need to appreciate diversity. So I think the first thing is, now that we're moving much more to a devolved administration for the NHS with the neighbourhood teams, there's a real opportunity, as we found during COVID, to work with local people and local charities and other people that know their population, to say, how do we tailor it to be best? So in a way, I think you're asking about how do we deliver and make sure that we include all those people. I think that is the way that we have to design delivery, design delivery for those locally. So nationally, we'll create the standards and what we do, how to connect to those services so that local people can have a say of the flavours of vanilla that they want in their tech. We'll be quite clear on rules and what they can and can't do. But there are some really simple things we can do nationally that, being Chinese background, I feel very passionate that I wouldn't do some of the things I had to do for my parents if there was a translation service that actually worked. So digital, we have a good opportunity to make that a consistent reality. And that isn't a huge amount of cost. We then need to really take notes from local populations, what they need. And the things that support diversity supports everybody, right? So making things more accessible, being a bit more considerate about how we engage with the public will support that.
Absolutely, and just as a tangential to that, the plan has been very candid, and that the NHS doesn't have a monopoly on the insights of digital transformation, etc. And one of the key pillars will be to be very open in terms of partnerships, with people coming with ideas about how we move from where we are from bricks to clicks.
Yeah, no, very much so. And we've taken that to heart. That's why for the single patient record, we've actually gone out with a request for information. It is that this is the concept. How do we do it? So we can shortlist to a number of concepts that we'll go and retest with the market. It's very much open to, Paul Corrigan calls it, we have to change the way the NHS is operating with industry. And I totally agree with that. I think we can be much more open. I think there's a win-win. I have a commercial background.
Sure.
We have to appreciate as an NHS, people don't go into business to fail and lose money. So, but in partnership, you can always find win-wins. But that's been very open and very thoughtful up front. What I think one of my criticisms of what we haven't done well in the past is probably only got to a situation when it gets sticky and then tell the supplier you've got to sort it for us. Whereas actually you need to build that trust and that relationship up front. You need the contracts, the commercial arrangements that allow you to have that freedom. But more importantly, to have that win-win investment type conversation. So it's not, all about price. So I think we're always going to be a public sector kind of body. It's never going to be free for all, but we do need to be a bit more mature in the way that we engage with organisations so they can bring their best to us. Because what I've found is most organisations really want to support the NHS. What they find difficult is the how, and the way that we often put tenders out doesn't make it that easy for them.
We'll have to do a separate podcast on about the principles of procurement. Otherwise, we might get stuck based on your consulting. Final point I wanted to look at was let's step back and look at the vision piece a little bit. We've talked about the shift, obviously, to neighbourhood and prevention, and obviously analog to digital. But I want to go back to hospital, actually. I know the plan says it's been too hospital-centric, but the hospitals are going to stay. They are going to play a part. A couple of quick things there. The promise, one of the big bets is robotics. And it draws on international comparisons and a very bold vision for hospitals to be AI enabled before the end of the lifetime of the plan, drawing on, I think, the Korean smart model. Paint that picture, because it sounds almost Star Trek-like at the moment.
Yeah, as Vin said at a staff briefing, it's not going to be RD2 doing your surgery. It is, if you think about surgery, and it's not going to be right for every procedure. A lot of it is about precision. A lot of it is about being able to see round corners. In the body. The bodies are never the same. You never quite know until you open it up. Having assisted AI to help the clinicians still perform the surgery is much more precise, less shaky hands, much more you can program in which leg or which side to do things and not, make a mistake because it's been moved around on the paper. So I think it's really exciting in that. But I think some of the treatments will be in the future of genetic cutting and changing kind of parts of it. You can't really do that as a surgeon. It's going to be very different. So there are those robotics. I think the advances in surgery, the clinicians are embracing it. I think the question for us is, we know there are 1 or 2 centres that are doing it well. How can we help other centres? And this is where the specialisation really starts coming in, because you really want to be able to have people that are really well trained and can do these well. And it probably isn't for every DGCH to have that. And having those hubs will help to maintain the centre of excellence for those things.
And one final thing I can't resist, because I know you began your career in pharmacy, trained in that. So we'll go back to the human genome. But on other big bets, you mentioned it slightly earlier, but there's a huge excitement around the promise of genomics and the closer ties with the life sciences industry, which Lord Darcy has called for, where the NHS is an engine not just for the health mission, but for the broader economic mission.
Yeah, so in our public engagement, we've explored this subject, and the British public are very altruistic. They want their data to be used to get better medicines, better treatments, actually have more opportunities to participate in clinical trials. So all of those things are really important to life sciences. Underpinning all of that, obviously, is the data. If we can pull off a single patient record, if we can pull off really connected data that's longitudinal, we have a very diverse population that's really important to life sciences in the way that they look at new treatments, etc. So I think we have a lot to offer. I think we do need to keep the public with us. They have some red lines that we've heard loud and clear, about insurance companies, about profit in some ways. We have to get over those things. But generally, having the NHS app to say, do you want to participate in this trial because it looks like your conditions would be really suitable for that, most people would say yes.
Well, look, I hope you'll come back to us again when all the delivery piece, which we will be rolling out. But for now, Ming, thank you so much for your vision and your clear excitement for the plan.
Thank you very much for the opportunity. I hope to come back soon.
We'll be absolutely delighted to have you back. Thank you.
Thank you.
If you've enjoyed this episode, please like, follow or subscribe wherever you receive your podcast. And if you want to know more about how we're turning the dial on health and social care debate, please visit newcrosshealthcare.com/voices of care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next podcast. I think that's what Ed would call a wrap.
Thank you.
Voices of Care, the healthcare podcast.